So our patient today is having a lower body lift and she's challenging me. So I'll let her start. You go ahead.
I live in Hermosa Beach and I play beach volleyball a lot. It's my passion. My whole life kind of works around it. So my interest in a lower body lift really is because of how much I'm in a bikini. So as we're marking where the scar is going to be, my main thing is I wanted it hidden in my bikini, and I wear a little bikini, teeny bikinis. So we're in the quandary of where to put the scar and knowing that it'll maybe make the results less dramatic by making the scar lower.
Right. Okay to share her age. She's 59. She's an avid player. So her life, as she said, revolves around her passion. And I always tell my patients, this is not my surgery. This is your surgery. And I want you to decide what you want. But at the same time, you have to appreciate that we are giving up some things in order to gain others. So, and she's not a weight loss patient. Most of her issues are obviously the thigh laxity, the butt laxity, and she was actually okay with the tummy, right?
Yeah.
Yeah, it was really the butt and the thigh. But to get a good result of a butt lift and a thigh lift and remove as much as you do here, you need to end up doing the tummy so that you can pull this against the tummy excision, which is what we're gonna do. The other thing that we were going to talk about is, show me where the bikini, normally your bikini is at.
I would say it goes about here.
Okay, so she's challenging me. She wants to wear a bikini and show half of her butt. No, I'm teasing.
You'd be surprised what people do nowadays.
It's the whole butt. I know. So the challenge is as follows, and that's why I really was interested in doing this video. This is, let me make you decent, sorry.
Okay.
So this is the area that starts under the rib cage and comes all the way down to here. In continuation of the groin crease is the abdominal region. From here downwards, we call this the thigh. So her normal her normal abdomen and thigh demarcation is here. So ideally we want to end up with an incision here, and the way I have marked it, as you can see, we are removing this upper abdominal skin or waist skin, we are removing the thigh skin and putting these together to end up in the anatomical region. And a lot of times I have patients who want the incision higher or lower, and all of those are doable. But the anatomical, the way I place the incision is according to your anatomy. And the anatomy tells me, hey, I want to end up being here, and it will end up being here today. And over time, it will come down a little bit more. So it's usually a little bit lower than where we place it in about 6 months to a year time. But today it will be here. So on the front, I think she's okay with that. Mm-hmm. But the problem is that incisions, you see these incisions go all the way across. So what you put on the front dictates, or what we put on the front or how much we cut on the front dictates how much we are cutting on the back. You can't stop the incision here, put a step here and go this way. I mean, you can, but it looks not very nice. It's not my work. And you can't do a zigzag, and people do funny things, but I'm sorry, this is not what we do. We work on getting you superior results. So we don't want to put an incision and then suddenly come down here. And that's what she's challenging me today. Now, the lower the incision is, there is only so much this butt skin will come up. So ultimately, if I follow the correct anatomy of her, this is what we'll get. I'm gonna put anatomy. This is, yeah, rotate her a little bit more. That's it, yeah. This is what we'll get, and the nice butt lift. But she wants me to go lower. So what we'll do now is to bring the incision lower here, and that will ultimately give her a lesser butt lift and outer thigh lift correction. And she's thinking whether that's okay with her. She's making that compromise to have a lesser correction, because you can't just bring the butt lift, the lower incision here and end up here, because it won't be a good lift. We'll do some of that for her because that's what she wants, but essentially it's a compromise in the degree of lift for the scar placement. And the problem that, or the issue that I want you to appreciate, is that scars tend to migrate down over time too. So you have to bear that in mind too when you make your final decision. So what do you want me to do?
I still like the plan to go lower on the side and back and compromise a little less lift.
Okay. So what we'll be doing is trying to bring these lower, and unfortunately that means she gets a little bit of a less lift, but as you just heard, she's okay with it, and she ultimately, and we'll try, I can't ever promise that I'm gonna end up exactly where she wants it, because again, over time, these things tend to come down a little bit more. But is that the way you would wear your bikini?
Yeah, that's about where it's going.
Okay, so our front scars are good. What we need to do is to try to bring the back one to here, and then over time it's gonna drop to here.
Understand?
Shall we?
Yep.
Our patient is now on the operating room table. We're going to be starting her lower body lift on her back. And this is where I would have put my normal markings so I can lift her buttock up more. And as you may recall from her description, she's a volleyball beach player, avid player. This is her passion. She wants her incision as low as possible. So we're gonna drop her incisions on the back by 1 inch. She initially wanted it here, but she really wants this incision as low as possible, she told me. So I can now bring it a little bit lower. That may make her buttock a little bit shorter. Essentially, we are shortening the height of the butt. And I don't typically like to do that because her anatomy is not changing, but that's what she wants. So instead of the scar being at the junction between the lower back and the upper butt, the scar is now gonna be, we are really making the back taller and the butt shorter by bringing the whole structure lower as per her request. The other thing is I can't just bring the scar here. You can't put the scar on the butt because this scar then needs to go on the front. And ironically on the front she wants it to be higher. So she wants a high scar on the front, low scar on the back, and it kind of doesn't work like that because this is a 360-degree scar. So you can't just do what you want. You have to follow certain rules. And I can't go like this low here and then turn right and then come left and so forth. So this is the best we can do. And this is gonna change her anatomy, but that's what she desires and she understands. So that's how we're gonna do it. So we are now done with the buttock lift. As a patient mentioned earlier on in her pre-op videos, she wanted this scar super low because she's a volleyball player or beach volleyball player, and they wear their bikinis are very, very low. And after some negotiation and deliberation, I followed her guidance and desire and brought the incision lower and she understands that by placing the incision lower, this will affect the shape of her buttocks. Now the buttock cheeks both look shorter and they won't be as round, but that's what she desired. And ultimately it's her surgery and not mine. I'm just a surgeon. And she understands the full implications of her desire or request. And we spent about half an hour this morning talking about it, and then she talked about it on the video. Actually, I think it looks pretty good. It was a difficult surgery. I had to end up reshaping the buttocks to some degree so that it wouldn't look deflated and flat and lopsided, to be honest with you. But we achieved the goal, and I think she's going to be super happy. And ultimately, that's the point. You know, we want to make her happy so that she can continue to enjoy her passion. So far so good. We'll be finishing the front soon. So we are now finished with our lower body lift and thigh lift. She's very bruised on her thighs. That's because of all the undermining that we did to pull the thighs up as much as we can do. Very close. We came down very close to the knees. And then, I mean, look at that perfect, beautifully placed incision. I created a high definition look for her tummy. Her navel was floated down and sutured down. Her abdominal muscles were tightened twice, so 2 layers of tightening. We also found a small hernia that we repaired at the time of the surgery and prior to performing her muscle tightening, and then lifted the front of the thighs and the pubic area and so forth, and created the high definition look. I mean, 59-year-old in the body of a 21-year-old. Just beautiful. Worked out really well for her, so I'm super happy. I think she's gonna be very pleased.